Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. I hope all of you are well and fine. Today in this video lecture we are going to see cardiac marker test or heart related blood test. Okay, if you guys remember, we already talked different cardiac markers blood test. If you wanted to see all the cardiac markers blood test, there will be a playlist into my YouTube channel. The name will be, the name of the playlist is cardiac markers, so you will find all the video lecture related to the cardiac markers like LDH, SGOT, CKMB, CPK. Okay, so today in this video we are just summarize the cardiac marker related blood test. Okay, so my name is Muhammad Kamil Khan and you guys watching my channel Kami Microbiologist. Let's start the video. In this video, the main content is introduction to cardiac marker, diagnostic purpose, requirements, test procedure, normal range, etc. First of all, we will see that what is actually cardiac markers. Dear viewers, cardiac markers are actually the substances. Some of them are proteins, some of them are enzymes, some of them are hormones. Okay, that are present in the heart muscle. Especially it is produced from the heart cells, and it will be released and produced at that time when there is a heart related problems like heart damage, heart failure. Okay, so at that time these cardiac markers will be released. The most common cardiac markers that the doctor is recommended, so these are the cardiac markers. Okay, now there are almost 8 cardiac markers, but the most common cardiac marker the doctor recommended, this is about the troponin blood test. Next he recommends CKMB, then he will recommend BNP, myoglobulin, LDH and CPK. These are all actually the cardiac marker. SGOT is related to the liver enzyme, but it is also involved in the heart muscle as well. HCRP, it is also related to the liver, but it is also involved into the heart muscle as well. That's why I mentioned these two as well in the cardiac markers. Next we have that when to perform this test. So remember, if there is chest pain, left arm pain, jaw pain, shortness of the breath, tiredness, so at that condition. Next, when in the report if you see that your triglyceride, BP, cholesterol level get high, when there is tachycardia condition, rapid breathing, loss of consciousness, dizziness, so at that condition mostly the doctor recommend cardiac markers, and among these cardiac markers the doctor mostly recommend troponin test. Next we have the diagnostic purpose. So the most common diagnostic purpose of these cardiac markers are that these cardiac marker tests are specially used for the myocardial infarction diagnosis, or we can say heart attack, or we can say congestive heart failure, etc. This test is also used to assist myocardial injury or ischemia. This test is also used to evaluate the acute coronary syndrome. This test can also differentiate between the chest pain causes. Okay, we can also perform the cardiac marker test to just check the treatment efficacy which are providing. Let's see the test procedure. It's very simple. Whenever you want to do a cardiac markers related blood test, so you have to take the blood in gel tube, red top, and one more thing, in heparin tube as well, means green top. Once you collect the blood, so then what will you do? You have to centrifuge the blood and will separate the serum or plasma. After that you will run the test into the Selectron machine or Mendra machine or any advanced fully automated machine. Okay, so this is how the test procedure. Let's see the normal range. So first of all we have troponin. So the troponin normal range will be between 0.0 to 0.3 nanogram per ml. CKMB normal range is 5 to 25 IU per liter, or 24 less than 24 unit per liter. BNP is 0.00 to 99 nanogram per liter or picogram per ml. Next we have myoglobulin. So myoglobin normal range will be 25 to 72 nanogram per ml or 1.28 3.67 nanomole per liter. Next we have LDH, so their normal range is 140 to 280 unit per liter. In case of the CKMB, the normal range will be the 55 to 170 IU per liter. SGOT normal range is next we have HSCRP, so the HSCRP normal range will be less than 1.0 milligram per liter. Okay, so then we have the main causes of high cardiac markers. Remember guys, the cardiac markers which we have already talked, it should be less, it will be not higher. Okay, there are some of the cardiac markers like SGOT, like we have LDH. If it get low, so there will be problem, but most of the cardiac marker, it should be less, it should be not more than higher to their normal range. If let's suppose the cardiac markers get high, so what will happen, or what are the main conditions through which all the cardiac markers get high? So it is due to the acute myocardial infarctions, these are due to the congestive heart failure or heart failure, it is due to the heart attack, acute or chronic renal failures, pulmonary hypertrophy and embolisms, myocardial myocarditis and pericarditis, strenuous exercise, smoking and alcohol, obesity and diabetes, severe burn. So these are the main conditions through which the cardiac markers get high. Next we have the treatment. Let's suppose if all the cardiac markers get high, so what will be the treatment? So the first treatment, we have antiplatelet agents. These are the medicine that are provided against the platelets. Next we have thrombolytic agents. It can dilute the clot and buster the clots. Next we have anticoagulant, beta blockers, ACE inhibitors, open heart surgery when there is severe conditions. We have physical exercise and rest for the heart muscles disease. If there is any type of the diseases like bacterial or viral, so then in that condition we will provide antibiotics and antiviral medications. So these are the treatment. So this is all about the cardiac markers blood test. I hope you understand. If you understand, so thank you so much. If you like this video, make sure to hit the like button, share this video and also subscribe the channel. If you have any question, you can write your question through comment. I will try my best to give you answer as soon as possible. Thank you so much for watching.